Thank you very much, Benny, for the introduction. And it's really humbling to be here, really, really humbling. So just yesterday, I was walking in the museum with my fiance, who is here. And one of the inspiring things is to walk through the museum and experience the technological progress that humans have gone through. And so it's really befitting to have this meeting here. But there is also an invisible element of human change that has always happened whenever humans have been and have always followed them. And this is disease. Disease have always existed with humankind and has always moved with humankind. But you have very little understanding of how disease is transmitted from person to person, especially for diseases that are transmitted through the air, such as tuberculosis. So I'll give an example today of our work of how we're trying to combine biology with technology in order to understand how disease spreads. And the reason we are doing this actually comes from an experience 15 years ago on an internet cafe. So James, what you're doing is really important because it is one of those internet cafes where I first use a computer. And it is then that I realized that the power of the computer to bring complex problems to a digital realm enables you to solve them at a rapid scale than would be possible without digital technologies. So this inspires everything that I do. And this is why I joined IBM Research Africa Lab. IBM has about 12 labs across the world in 6 different continents. In the last 5 years, IBM has opened 2 labs in Africa, and this is a bold move because IBM Research Labs is only among the few that are existing over the past 100 years. Many industrial research labs closed down, so like Bell Laboratories. But IBM has taken the bold move even to enter into a new continent. And so this is where we are, in a neighborhood called Shimologong Precinct. Shimologong as a Sotho word, meaning the place of new beginnings. And this is really important again for me as a biologist, because just 30 kilometers outside of Johannesburg is one of the sites where a lot of human hominids have been found. The richest human hominid site lies 30 kilometers outside of Johannesburg. And we hope that it is here in Johannesburg that we can begin also exploring some of the big questions of humanity, so ranging from healthcare, or things like understanding the origins of the universe, which are all areas that we are working on at the IBM Research Lab. And this idea actually goes back of the lab about 2 years ago. Professor Barry Dewalski, who is a professor at the university there in Johannesburg, had this vision of having a technology hub that brings big companies and small companies into one place. And here our director, Dr. Solomon Asefa, who is really inspiring. He's done some amazing research on developing photonic technologies for enabling faster communication in computer chips. And here they are standing in a former nightclub in an inner city, which has now been transformed 2 years later into a digital hub where startups can begin to solve important problems. And our lab at IBM Research Africa. And most importantly, having the people from different parts of Africa and from different parts of the world to fill this lab and to try to solve some of the most important problems facing humanity. And so as an example, the work we are doing on how to track tuberculosis, indeed one of the old diseases known to man, tackling it with a new technology. And why tuberculosis? So tuberculosis has coexisted with humans for over 70,000 years. We know this from a recent study that shows that for over 70,000 years, in fact, the time that humans were beginning to migrate out of Africa, tuberculosis already coexisted with humans. And it followed humans through their migrations and through our recent time in history, through the emergence of HIV. And so through all these moments, tuberculosis is having a huge impact in our lives. Tuberculosis surpassed HIV AIDS as the leading infectious killer disease last year in the world, claiming about 2 million lives around the world. But why is TB still a problem? If you look at the history of this disease, and again, thanks to DNA sequencing technologies, we've been able to date TB DNA and see that from 1550s, there was a strain of TB that existed. And the level of this strain increased during the First World War. And also there was a peak that started at the Industrial Revolution. So seeing how human impact is affecting the emergence of a disease like TB. So we can say that over human history, other infectious diseases like HIV, for instance, have had an incredible impact on the cases of TB that we see. But also, most importantly, our own industrialization, as our cities grow, the problems of overcrowding, travel, all these are factors that contribute to the spread of disease. But really, if you look at it, we do not understand how TB spreads from person to person. We know, okay, that if somebody has TB, there's a chance that somebody who spends a long time next to the person might also acquire TB, but it is not guaranteed. So we don't have a very accurate or reliable measure to see how TB spread. And normally TB, studies that look at TB spreading do something called contact tracing. And basically, they try to ask anybody who has TB how many other people they have been in contact with. Now imagine if you ask that. You can't remember every single person that you came in contact with, and it is not possible to follow each of those single people. So the current approaches for performing contact tracing are really limiting. And so this is where we come in to ask, how can we use technology to make a difference? And so at our lab in Johannesburg, we're beginning to develop devices that could actually help in doing this. And here are two researchers in my team, Darlington and Toby, a very brilliant engineer, working on a new wearable device, building it locally there in the lab. And most importantly, it's also combining two areas of technology. So this is the beauty of having a lab where you have biologists working alongside engineers, working alongside people who come from very diverse backgrounds. And we know from previous studies that there's been some trials that have been done on using wearable sensors to try and trace the spread of TB. But the problem with these studies is that some of the sensors are very expensive. So what we are looking at in our lab is to develop a local technology that could be much cheaper and much reliable. So basically, a wearable device for low resource settings. And here is a prototype of that, that device. So it would be something like this. And basically, this device uses a radio frequency module, which is very similar to some of the circuits you might have in your TV remote control. And it utilizes a very small sized battery. And so because of this, it's very cheap to make. And actually, we are hoping that we can cut down the price even further. Most importantly, its battery can last many hours. And also, we are developing algorithms that help us to store the data in a more efficient way, and to be able to use the data from this device to infer contacts between people, even if we can't give every single person this device, because we know that is not possible. And basically, the way the device works is that if you have one of the devices, so tag 1, it sends a ping. And at some instances, it also listens for a ping from any nearby tag that might be there. And if it receives a ping, it stores that ping, and it stores the ID of the tag it saw. So because it only stores the ID of the tag, it also ensures that we may not necessarily know the identity of the person having the tag. So you can still protect the identity of the people. And basically, the idea is that from this, we can begin constructing these networks that show us who has been in close proximity to another person. So this is from an experiment at our lab. And basically, we can see that there's places like the kitchen, where there's a lot of people that go there all the time. We can see that people who like to go playing table tennis, maybe we can begin to look at certain things or patterns that emerge in people who share the same sort of networks. So this is just the beginning. We have a long way to go. There are many open questions that we have to address. One is that what would be the incentive for people to actually wear this kind of device? So we are thinking of making this device into something that can be a fashion garment. It could be a part of your wristwatch. It could be a tag on your mobile phone. It could be your belt. It could be a hairband. So different ways of miniaturizing this device to make it more accessible to more people. And then, of course, we are also using machine learning methods to be able to infer contacts, even if we can't give every single person the device. There are ways in which we can reverse engineer contacts given only a limited amount of data. So it's really a pleasure to be here, and I hope to have some questions later. Thank you.